Awesome. And now I'm going to turn it over to Michael Messenger. He is the training expert with APS, Adult Protective Services. So, Michael, the floor is yours. I'm really glad you're here today. Thank you so much, and take it away.
All right, training expert. Lowering expectations. I always love that. Thanks. Yeah, and sorry I was couple minutes late getting everything set up here today. All right, so I am Michael Messenger. I'm so used to speaking to audiences of people who all know me from APS. So I am a training program manager at APS, which amongst the alphabet soup of DSHS acronym stands for Adult Protective Services. I started with just a little bit of background about me. Started with DSHS, looking at the calendar about 8 years ago now, in Region 2, which for APS is based in Seattle. Actually, when I started, I was doing sort of record requests, public disclosure stuff, and now training program manager. So we develop the trainings for APS investigators and staff and train them in conducting investigations, partnering with our community partners and all sorts of things like that. So today, the presentation is one to get an overview of APS, an overview of the population that APS works with, an overview of the kinds of things that APS investigates and what to expect if you make a report to APS, what to expect from an APS investigation, a little bit about mandated reporting, since if we are working for the Department of Social and Health Services, we are all mandated reporters for elder abuse. That's a little bit about what the presentation is. There is lots of space during the presentation, lots of space after the presentation for questions. We use these presentations to give people the overviews and some of the basics, but then really open it up to let the group sort of drive where the conversation is going to go. So if there's questions at any time, Anthony or anybody else, feel free, who can interrupt, feel free to interrupt and let me know the questions so we can get to those right away. Or at the end during the discussion time, I'm happy to go in as much as I can to the different areas that the slideshow touches upon. If there's more in-depth conversation that people want to have. So I am going to share, start sharing my screen. And all right, that should be our presentation now. All right, so yeah, there I am. My name on the presentation today. All right, so what is APS? APS, we're our own division now within DSHS. For those of you who have been around for a few years, we used to be a part of HCS, Home and Community Services. That changed about 6 years ago now. We became our own division, and we are given the authority in state law to investigate allegations of abandonment, abuse, neglect, and financial exploitation of vulnerable adults, and also to offer them protective services, to try to connect them with services in the community to help improve their situation. RCW 7434, again, a little background, that's where we get our authority, passed in 1984, to investigate, again, vulnerable adults. We're going to learn a little bit about that coming up now, because that's sort of the key thing. That's where our authority lies. And so vulnerable adults, when someone asks, who does APS work with? What clients, what people does APS work with? It's vulnerable adults. So who's considered a vulnerable adult in the state of Washington? We have an understanding in our communities, right? And for ourselves about what a vulnerable person is. If we're asked to define that to ourselves, we may think, oh, it could be, someone who can't take care of themselves. It could be somebody over the age of 65. So we have these sort of criteria that we might use in our own lives and in our own communities to identify, that person over there, that person's vulnerable. At APS, though, we have a very specific definitions, I should say, in statute, in law, and define the population, right? Who is technically a vulnerable adult for APS jurisdiction. And this chart sort of illustrates and explains who those people are. I'm going to start. We're going to leave the one on the far left just for a second. So an adult, someone who's 18 and older. All right. So we're dealing with people who are 18 and older. And what under Washington state law makes someone a vulnerable adult? Those are the categories from the word and over to the right. So a vulnerable adult in the state of Washington, someone who's 18 or older, someone who has a guardianship or a conservatorship, right? They're subject to a guardianship or a conservatorship. Someone that has a developmental disability, someone who is admitted to a DSHS licensed facility. Critically, that leaves, not critically, importantly, interestingly, that leaves out hospitals, right? Hospitals are licensed by DOH. So these are DSHS licensed facilities. These are your adult family homes and things like that. Next one is someone who is 18 or older and receiving in-home health or hospice care caregiving services from an agency, receiving service from an IP. So if they have an individual provider, they're considered a vulnerable adult. And the last one on the end there, if they are self-directing their own care. And again, that is sort of a technical term. You may or may not be aware about that, but that involves things like physician approval and some sort of compensation and payment to the person providing the care. So it's not just someone who's sort of controlling their own care. There's some requirements for that. So that's when they turn 18. Those are the 6 things that make someone a vulnerable adult if they're 18 or older. On the far left, you'll see that when someone turns 60, not only do we have those 6 things, so if they're 65 years old and they're admitted to a facility, right, they can still be a vulnerable adult because they're admitted to that facility. We get a couple of extra options to include someone as a vulnerable adult when they turn 60. And that would be someone who's 60 years or older with the physical, functional, or mental inability to care for themselves. All right, so they'd have to be over. So if we're looking at someone who's unable to care for themselves, either physically, functionally, or mentally, they have to be 60 years or older if that's the only way they're going to be a vulnerable adult. Which means, right, if you think about that for a second, someone who has none of the other 6, right, no guardian, no developmental disability, they're not admitted to a facility, they're not receiving caregiving services, they don't have an individual provider, and they're not self-directing their own care. So they have none of those 6, and they're 59 years old, and they can't take care of themselves, they're not a vulnerable adult. It's sort of the hard line drawn, and that's what I mean, where we think of people who might be vulnerable in our communities. This is, for APS, this is what our statute gives us the authority to investigate and the population that we can work with. So that's who is the vulnerable adult, right? These are the people who are our alleged victims. If you hear me accidentally slip up and I say AV or AP today, just because that's, within APS, we use those terms so much that we forget that outside of APS, people might be like, what are you talking about? So if you slip up and hear me say AV or alleged victim, that would be the person that is alleged the thing happened to, right? Those are some people call them clients, right? Those are the vulnerable adults that we're working with. If you hear AP or alleged perpetrator, that is the person alleged to have done the wrong or abused them or financially exploited them or neglected them, right? So we have AV, alleged victim, and AP, alleged perpetrator. That's the who are vulnerable adults. That's one piece of it. The other piece for our jurisdiction is, right, the kinds of things, the kinds of mistreatments that APS investigates. And here they are, right? Physical. So we have sort of one category is abuse, and abuse is broken down into a few different kinds of abuse: physical abuse, mental abuse, sexual abuse. Those are sort of the ones that sort of immediately come to mind as sort of straightforward. But then we also have improper use of restraints and personal exploitation, and we'll talk just a little bit about these coming up. But those are the 5 kinds of abuse. We also investigate abandonment, financial exploitation, neglect, and self-neglect. All right, so we're going to start with abuse, just really quickly to run through what these mean. We get a little understanding about that. Starting with abuse. Again, this is from the statute, right? but it's basically something that inflicts injury, unreasonable confinement, intimidation, or punishment on a vulnerable adult with some level of culpability, right? Some intent behind doing it, right? We have different levels that we go through with our investigators when we're training them, but I think for now it suffices to, for understanding, right, that there's some level of intent, some intention to do it for abuse, some knowledge about the wrongdoing. This way of, I guess we should have popped this before that last slide, but just so you get a sense of what the kinds of things that APS looks at, as you can see from this chart, this was last year, so cycle 2023 data for the allegations in APS investigated as percentages of the total. You can see that financial exploitation at almost a third of all of our investigations are financial exploitation investigations. And we'll see a little bit about why that is not just money. So we'll see a little bit about that when we get to financial exploitation. You can see self-neglect, the next one at 18, mental abuse and neglect also, and physical abuse also above 10. You can see abandonment and improper use of restraint being on the lower end of the ones that we typically look at. But this can give you a sense of the amount of allegations an APS gets in these different areas. So physical abuse is a physical mistreatment. In essence, that's what physical abuse is, right? Some sort of state of culpability, some sort of intent to cause a physical mistreatment. Things like striking, slapping, pinching, choking, shoving, prodding can all be physical abuse. It's not limited to those things. I think it's one of those ones that's relatively straightforward for us to think about. And what you're thinking about when you think about physical abuse probably pretty well matches the definition in our statute. Mental abuse. Key thing about this one, it can be verbal or nonverbal, right? So it doesn't have to be. I mean, we all can typically think of the yelling at people or the things that people do verbally to people, but it also includes nonverbal actions. And so the key for this is that for mental abuse, we're looking for something that's threatening, humiliating, harassing, coercing, intimidating, isolating, or unreasonably confining or punishing a vulnerable adult. So those that were limited to those ones. Again, just to give you guys some knowledge, each one of these things has its own little, curiosities and ways to think about it that I love to go through. And so I apologize if I slip into it sometimes, because that's where my real sweet spot is sort of these definitions and what they mean. But so that's sort of the typical amount, right? We think of things like I said, the yelling at people, again, the isolating people, intimidating people. You get a sense of what that might look like. Just I think the important thing for mental abuse, if you're thinking about being a mandated reporter, things you might hear about, things you might see happen, is that it's both verbal and nonverbal for that mental abuse. Sexual abuse. Again, one of the ones that's, I think, relatively straightforward in our minds. It probably matches pretty well with what our statutory definition is for there's two sides. It's not reflected necessarily in the slide. There's two sides of the sexual abuse. One is for sort of general public. The other one is for an alleged perpetrator who is a staff person at a facility or an employee of a program that works with that vulnerable adult. And so we'll get to that one in a second. So generally speaking, sexual abuse is any form of non-consensual sexual conduct. And again, sexual conduct is broad. It's not limited to the things that are on the screen here, but this can give you some sense of what they are, right? Obviously, things like inappropriate touching, rape, sodomy, sexual coercion, but it also includes, right, sexually explicit photographs, if you're taking those of people, right? So it includes lots of different kinds of sexual conduct and are beyond the sort of rapes and touching and things like that. Sexual harassment included as well. Now, the difference when we get to someone who's a staff person at the facility where the AV lives, or they're an employee of a program that works with that alleged victim, is that it doesn't matter if the sexual conduct is non-consensual or consensual. It's potentially going to be sexual abuse, right? And that's because of that power differential in that relationship. So again, for those staff people or those employees at programs, it's any sexual conduct can potentially be sexual abuse. Improper use of restraint. We have three kinds of restraints: chemical, physical, and mechanical, right? These are sort of, what we think of. There's sort of ways to limit the vulnerable adult's ability to move, right? The freedom of their movement of their body. There's some other requirements as we delve down into these, right? But drugs, basically for chemical. Physical would be using their bodies, right? Holding somebody down, sitting on someone. Mechanical would be using a device to restrain them. So that could be something like tucking them in too tight, right? It could be using a gait belt to tie them down to a wheelchair or to a chair. Tying their wrists, right? That would be mechanical restraint. And like it says on here, convenience or discipline, it's the inappropriate use of these restraints. If they're authorized by medical professionals, if they are authorized for use and they're used in the right way, right? Lots of things are appropriate to use to help keep people safe. So it's really when it's inappropriate, when the use is inappropriate, when it's not used according to those licensing requirements, when it's used for convenience, for discipline, right? For reasons that aren't directly related and completely related to keeping that person safe, right? There's some other wrongdoing in there. Personal exploitation. This is when we see, like I said, right, people who are sort of maybe making the vulnerable adult do things they wouldn't normally do, taking away their freedom of choice in doing that thing, or making them perform services, right? Do things for other people. Examples of this, of personal exploitation, might be, right? So taking away the freedom of choice. What I mean by that is like a caregiver saying, yeah, if you don't drive me around and my family around to all the things that we need to go to, I will stop providing you care, and I will tell everybody else to also stop providing you care. You will have no care if you do not do this for me, right? Technically, that person has a choice, right? That victim has a choice. They could refuse and lose all their care, or they could drive the person around. Now, that's not a real choice. So those are the kind of situations where then we can see under personal exploitation. That would be an example of doing something for somebody else, performing services. If there's someone's consistently not doing something or consistently doing something, and the AP is doing something to stop them from doing things they've always done, or to start them doing things they've never done, right? That pattern changing, that can fall under personal exploitation too. Again, with our intent requirements on the part of the AP, this is usually one of the ones where the person's meaning to do it. Threats and things like that, very common for personal exploitation. Like the example that I gave, right? We can sort of see that as a threat, as well as that undue influence. To get at that. Abandonment, one of the ones from our chart that is one of the rarer ones for us to investigate. If you've been around APS for a little while, everybody has that one sort of abandonment case that they remember from their time, because they're, the ones that stick out are few and far between. I think it was like 0.1% or something of our investigations are abandonment. This is, like it says, right? We see action or inaction. Abandonment and neglect, the two allegations we have where you have to have someone with a duty of care. And we can talk, maybe it might be worth mentioning for the audience what a duty of care means if you're out there trying to figure out what that might mean. So duty of care is either someone who is a guardian or a conservator, right? They have a duty of care. Someone who's an attorney in fact, right? So that would be somebody who's given powers under a power of attorney document. They have a duty of care. And then, but it also includes people who are providing basic necessities of life to the vulnerable adult on a continuing basis. And there's two categories of that. The first one is those who are paid to do it, right? Think paid caregivers. They are paid to provide the AV with the basic necessities of life. And the other one are people who do that voluntarily, right? So informal caregivers can also establish a duty of care to the vulnerable adult if they are providing those basic necessities of life. And again, think water, shelter, healthcare, food, right? Things like that, on a regular basis, on a continuing basis. Then that can sort of lead to a duty of care as well. And for abandonment, so we have that person with a duty of care. For abandonment, that person is leaving the vulnerable adult without the means or ability to obtain necessary food, clothing, shelter, or healthcare. Abandonment is sort of one where the word abandonment, sort of colloquially used or in everyday language, the way we use it, it kind of seems like, oh, like they left, they went to the hospital, they dropped the person off, and they drove away. They clearly abandoned that person because they left them alone at the hospital. Well, but look at our definition of right, and that person still has the means and ability to get the necessary food, clothing, shelter, and healthcare because right, they're at the hospital. So that's why abandonment, the investigation, the number of investigations for abandonment is quite low. The one, again, everybody has their one. The one that I remember from the people used to talk about was one where someone put a vulnerable adult onto a plane. I don't know where they were coming from, to SeaTac. They put them on, instead of dropping to the hospital, they dropped them off at the airport and put them on a plane. And then the plane took them to SeaTac, and they got off the plane in SeaTac and had no ability to communicate. They had no ability. They were not at home, right? They had nothing here at all. The person just put them onto a plane, and they got off the plane here with nothing. That was the abandonment that I remembered. So relatively rare, but important for us to keep in mind. Financial exploitation is the illegal or improper use, control over, or withholding of property, income, resources, or trust funds of the vulnerable adult by a person or entity for the profit or advantage to somebody other than the vulnerable adult, right? So what that basically means, right, is then someone's doing something wrong with the alleged victim's stuff. There's lots of different things that can apply to, and somebody other than the alleged victim is benefiting. It doesn't have to be the person who's doing the exploiting, which is to say that if I exploit a vulnerable adult and I give, let's say I take some money, right? I steal some money and take some money from them and I give it to somebody else. So I haven't benefited in any way, right? I haven't benefited. I don't have the money. I didn't buy anything with the money. I didn't get the money, but somebody else did, right? That can still be financial exploitation, even though somebody other than the person who did it is benefiting from it. I think you saw on the chart that financial exploitation is the biggest chunk of our investigations are financial exploitation. Part of that, it should be said, is that this is where all of the scams, right, that are so prevalent, unfortunately, in today's world lie, right? The sweetheart scams, people calling up and saying, hey, give me your bank account number and your PIN and I'll transfer you some money. All these kinds of scams that we hear about. They fall under this. The other part of it, though, is that it's not just money, right? It's property, right? It's resources of the alleged victims too. So property includes all kinds of things, not just money. It can include use of cars. It can include use of someone's house, right? If they're improperly, using someone's house. It can include things like care hours, right? If they're claiming care hours and not providing care, that could be possible financial exploitation. It can include their identity. If they take their identity and open up a bank account or other things like that, right? So it's a wide range of things that this can apply to. It's not just money. And that's part of why I think it has we get so many of these investigations, because so many things can fall under it. Neglect, there's two parts of our neglect. The first one is a pattern, pattern, we're looking at multiple things. And someone with a duty of care does or doesn't do, then fails to maintain the physical or mental health of a vulnerable adult, or then fails to avoid or prevent harm to that person, right? So we're looking at a pattern, more than two things. Doesn't have to be the same thing. So it could be they miss medication one day, they don't take them to a doctor's appointment the next day, and they don't, help them make food for them the third day, right? That's three different things, but it's still a pattern. So that would be a pattern that's failing to maintain their physical health, let's say, right? So that's neglect A, is that pattern. Neglect B, as we say, right, the second part of neglect, the other option will be a one-time thing that demonstrates a serious disregard of consequences and is a clear and present danger to that vulnerable adult's safety or health or welfare, I guess, as it says. And the essence of this, right, is that we're looking at that one-time thing and we're saying what this person did, right, is so dangerous to our alleged victim, and that's neglect. Even if that bad thing doesn't happen, right? They missed this medication today one time, and it was so dangerous. The risk was so great. It was a clear and present danger to that person to miss that one medication, or that, taking the medication that one time. Then this is neglect. It was so dangerous, and they ended up fine, right? Even if they ended up fine, it was so dangerous to take that chance. Then it's neglect. So that's what we're looking at for neglect. It typically, so one of the clear-cut examples about what could be neglect B would be like drunk driving, right? Whether or not there's an accident or not, that's neglect B, right? It's a clear and present danger to that vulnerable adult being in the car with that person who has a duty of care. Self-neglect, the last of our allegations. This one is the failure of a vulnerable adult not living in a facility to provide for themselves the goods and services necessary for their physical or mental health, right? And the absence of those services or goods impairs or threatens the vulnerable adult's well-being, right? So let's break this down a little bit. So first of all, you'll notice it says a vulnerable adult not living in a facility. So that's important to keep in mind. You can't self-neglect, right? So a self-neglect is when we get an intake in the investigation, there's no alleged perpetrator, right? We're saying the AV themselves is failing to do something, to provide some things for themselves. You cannot self-neglect if you are in a facility. By definition, under our laws, that's the case. So if they're living in a facility, they cannot self-neglect. The second part, right, is that they are failing to provide goods and services that are necessary for their physical or mental health, right? And again, the last part, not having those things. So we're saying that here are some things they're not providing to themselves. And we're going to say then not having those things is threatening to their well-being, right? Threatening to their well-being. Things in terms of self-neglect to think about. Other important factors in here could be, are there patterns of things that they've done or not done that are changing, right? If someone has always used sort of homeopathic, perhaps non-traditional treatments for their illnesses, and they continue to do that, maybe we look at differently in terms of self-neglect. But if they don't, right, they're not doing that all along, they've been using the more traditional medicine, and then all of a sudden there's a big change, we may want to look at what's going on with that situation and see what's changed. And is it a cognition? Is it decision making? Is there some situational change? What's going on there? Self-neglect too, I will say, right? So because there's no alleged perpetrator, in terms of APS, the self-neglect, right, the end game for a self-neglect investigation, that the person doesn't get punished for self-neglecting. They don't go onto a registry. There's no penalty to them, right? It's really about getting them the support that they need, connecting them to the services that they need. If necessary, things like guardianship and all of the, so with our new guardianship law, right, the sort of the less intrusive alternatives to guardianship, like those protective arrangements and things like that. It's really about getting that person the support that they need and building a record at APS for what this person's situation is, so that we can understand it if we get our intake for it. It's not about, again, so there's no, just so we're clear, right? Because sometimes our investigators come in and they're like, well, I feel bad about something on this person who wants to go on a registry. There's no registry for people who are self-neglecting, right? The emphasis is really on getting them that support. I should mention that as a part of the response to COVID and the realities that we were all dealing with during that time in terms of access to people, exposures and staffing levels and all that kind of stuff, there were, they call it a contingency plan put in place for APS. And one of the things, I think still in Region 2, which would be King County North and all of the islands, and Region 3 for APS, which would be, between the two of them, between 2 and 3, encompasses everything west of the mountains. And everything east of the mountains is Region 1. So everything west of the mountains for APS right now. As a part of that contingency plan, there are times when if a self-neglect referral comes in and there's already a case manager assigned, then that report to APS, it will screen out, which means there won't be an APS investigator assigned. They'll let that case manager know, and let that case manager manage the case and hopefully help that person access any services that they may need and work with them. The exception to that is typically if there's sort of a high probability then a guardianship is going to result, or the situation requires a guardianship. That's a time when that might not be true. But again, that's not permanent. That's just sort of right now as that part of that APS contingency plan. In terms of reporting, our laws don't require mandated reporting for self-neglect. Just bear that in mind too. We have two kinds of reporters in Washington, mandatory and permissive. If you work for the department, you are a mandatory reporter. There's other definitions for other people who are mandated reporters, people who work for medical professionals. There's a whole list in the statute of people who are mandatory reporters. Permissive reporters are people who are encouraged but not required to make reports, and that would be everybody else. The requirements of mandated reporters are to report suspected mistreatment of vulnerable adults to, it says DSHS on the slide, APS, and report to law enforcement if there's a physical abuse. Is there a question now? Is that what that pop-up means? In the Q&A, let's see. I'm gonna take it. So
yes, that's
I don't know.
What it is, I'm sorry,
Okay,
Michael.
thanks. Sorry, that's okay.
No, I apologize. I was just going to say,
no.
There was a question that popped up. Tracy asked, can neglect include animals such as not caring for the animal appropriately and allowing them to use the restroom in the home along with the other unsanitary conditions in the home?
Yeah, and thanks. I'm never been on here as I don't know what you call it, presenter or whatever. I don't know what that. There's a fancy word, and you got to let me in as panelist. There we go. So I'm learning too. This is kind of cool. Let's see. Can neglect include animals not caring for animal appropriate life to use the restroom in the home, along with other unsanitary? So, so for neglect, we can even go back and just for the sake of having it on the screen here. So pattern of conduct or an action by a person or entity with a duty of care that fails to provide goods and services to maintain the physical or mental health of a vulnerable adult, right? So the treatment of the animal wouldn't be something that APS would look at. Now, when the second part of what I'm seeing there goes to this unsanitary conditions in the home, if that person has a duty of care to that vulnerable adult that includes housekeeping, includes providing some things around the house, and that sort of condition is within that duty of care, then allowing those animals to go to the bathroom in the house and make that unsanitary condition can definitely be something that could be neglect. Again, duty of care being the key for that, someone with a duty of care. So not just anyone living there. There's no automatic duties of care. The definition I gave you for, or I described as a duty of care, that's it. So there's no automatic duty of care for living with someone. There's no automatic duty of care from being married to someone. There's no automatic duty of care for being family with someone, right? So it really looks at if you're not sort of a formal court-appointed or legal document-appointed duty of care, and you're not paid to provide care. So there's informal situations. The real question is, what basic necessities are you providing on a continuing basis for that person? And so if it's like to your example, right, if they are, and part of that was housekeeping and maintaining a sanitary environment, that's what the duty was to that vulnerable adult, then absolutely allowing animals to go to the bathroom and making those conditions unsafe and dangerous could definitely be neglect, and probably neglect A, because that would be a pattern that we see over time. But again, good question. Yep, and definitely could fall in there. I have powers to answer it live or cool. Okay. And again, we're back to the requirements for mandatory reporters reporting to law enforcement if there is suspected sexual assault or physical abuse. When to report, there may even be a slide coming up about when to report. It's sort of as soon as possible. You don't want to sit on it for a while if you're out in the field, or you're on visits all day, right? When you get back to your desk, that's fine. But it's sort of as soon as you can. So as soon as possible, make that report. I know at the end of the slideshow, there's information too about where to make that report. In terms of confidentiality, right? If we're mandated reporters, if we're thinking about calling APS, making reports, we see something we're calling up, reporters' identities are confidential under state law, right? It's specifically called out the identity of the person making the report. The only times when that information might go out from DSHS would be, right, a judicial proceeding, right? There's some sort of hearing, right? A judge orders us to give it out. Sometimes referrals that we have to investigative partners, if they request that information specifically, like DOH or law enforcement, they'll get it. But again, very narrow exceptions to when that reporter identity goes out and is released from APS, even to the point where if you, they shouldn't put something in writing saying you are not the reporter or you are the reporter, right, for your own records or anything like that. They won't confirm or deny whether you are or not, even if you call up and ask. All right, so if you're making a report to APS, what are some of the things that are real helpful for APS to get? Obviously, your contact information and the name and any demographics of the people involved are very helpful to them. The allegation, describing what happened, describing how you know about it, if you saw it happen, if you're a firsthand witness, if it's something that a client told you about, if it's something that you overheard someone talking about. This is, sort of how you came to know that knowledge is very helpful. If there's any other interested people, if there's any, we call them collaterals in sort of APS lingo. If there's any other contacts or people involved, that information is very helpful to have at for our intake workers to put into the intakes, so then our investigators can have that little bit of a head start in locating all of those involved people to reach out to them and really get the ball rolling with the investigation. The process at APS, working from top to bottom, we're gonna, if you call them up or you submit a report online, what will happen, right? We'll get the report. Our intake workers and our intake units are going to determine if the situation you're describing involves both a vulnerable adult and an allegation that fits into one of the definitions that we talked about today. And if they determine either that the person is a vulnerable adult or we're not really sure, right? We need to do some more investigating to figure it out. And there's an allegation, they'll assign that referral that you make for investigation. So it's going to get to an APS investigator. They will also make referrals to other agencies at intake as they determine we need to, whether it's law enforcement, again, Medicaid fraud, could be DOH, could be RCS, or other investigative partners, could be a tribal APS or tribal law enforcement, if that is applicable to the situation. Then what happens is that investigator is going to get it after, if it's screened in, if it's screened out, there's no investigation, as I mentioned earlier, right? So that just sort of ends the process for APS. We can make referrals if we screen it out, but APS's involvement is finished at that point. If it's screened in, it gets assigned to an investigator. That investigator investigates the allegation. That includes calling the reporter back. So if you reported something, you may get a call back from an intake worker. You should expect also another call from the investigator if it's screened in. That's part of our policy, is that they call reporters back. So we get a couple of phone calls potentially from APS. They'll conduct their investigation. Typically, the goal is to finish them in, this is the sort of one of those measures to finish the investigations within 90 days. There are, of course, circumstances where that's not possible. There are reasons why we can keep them open longer than that. And so, that can really depend on the situation for how long that takes. During that investigation, the investigator will offer the alleged victim appropriate protective services. Again, these are not always things an APS offers, right? So they could be mostly connecting people to resources in the communities, connecting people to things like home and community services, to legal services, maybe if they need those, or we can connect people to places. There's another question, I think. Did it go away? and really working. So identifying things that can maybe improve the situation that APS found our alleged victim in. So sometimes they're direct to the allegation, right? It could be, providing them information about how to get a protective payee if there's some sort of financial exploitation going on, how to get, information about where they can go to learn about power of attorney documents or things like that. If there's some financial thing going on, it could be connecting them with Meals on Wheels. If we're seeing that there is, a need to, they have trouble getting around to get food for whatever reason. So really sort of tailoring those services to the alleged victim and their situation. They'll determine a finding. We have 3 findings. We have unsubstantiated, inconclusive, and substantiated. Again, I think pretty intuitive, right? Unsubstantiated means APS says whatever the allegation was didn't happen. Inconclusive means then for some reason there's something missing. There's some evidence missing. There's something that's not reliable. For whatever reason, we don't really know one way or the other. And then substantiated is when APS says that the allegation did happen. Again, sort of thinking about an overview, there are some things that there are some misconceptions out there sometimes about what APS can and can't do. So just to be clear, these are some of the things APS doesn't have the authority under state law to do. We don't remove people from homes against his or her will. All right. APS is not someone who's going to march into a home. The investigators are going to get there and be like, all right, we're packing you up. We're moving you out. This is, we got to get you out of here. That's not something that APS does. APS will also not investigate the allegation unless the person is a vulnerable adult and we have an allegation. As soon as APS has enough information to establish that someone is not a vulnerable adult, right? Those 7 categories that we talked about way at the beginning. As soon as we can prove that someone's not one of those 7 things, right? Not that we're not sure, not that we don't have information about it, but we can prove that they do not fit into those categories. Our authority, our legal authority to investigate ends. And so we close those investigations immediately once we learn that. APS doesn't have the authority to detain or arrest individuals, right? We are not law enforcement. We are part of DSHS. We are a civil investigative agency. We don't detain people. We don't arrest people. We make referrals to law enforcement and let law enforcement make their own choices and decisions about whether to investigate, whether to detain, whether to arrest people. That's a law enforcement and prosecuting attorney office decision on that. We also don't act as a guardianship service. We are a petitioner of last resort for guardianships. We also don't act as an emergency response. If there's something going on that is emergent, your first call is to 911. Right? APS, we're not emergency responders. We don't have training to provide emergency medical assistance or to intervene like the law enforcement might to like a violent emergency situation. So the first call should be to 911 if there's an emergent situation. We're not an emergency service. We also, right, so the other thing about that, right, is that we work regular state hours, right, 8 to 5 Monday through Friday. So if something happens on a Saturday, APS is going to learn about it on a Monday, right? So again, not an emergency response tool out there. Call 911 if something emergent is going on. Hopefully they'll call us next and let us know about it too. But we really want to make sure that those people are getting the help that they need from emergency responders if they need it. We put this in because we kind of got to, right? Failure to report, a person who's required to report, right? Mandated reporters, and they fail to report. It's a crime. There's also a crime to intentionally make a false report, right? Intentionally make a false report is also a crime. Again, APS doesn't enforce these. That would be the police and the prosecuting attorney's office. But I think it's in here to make sure that we know. Let's see. We have a question. What is meant by petitioner of last resort in regards to filing for guardianship? So that means that we're going to exhaust looking at all the other people who could file for it before we do, given the limited resources that we have. So if there's someone who's able and willing to do it, then we'll ask them to do it. All right. It's in right. We're not a guardianship service, right? So if it's trying to get away from people just calling APS because they want someone to get a guardian, right? If there's someone who's able to do it who's not APS, then we're going to explore that before we go and file. Hospitals, family, typically. Yeah, we'll explore all of those before we file. That's what that means. It just means that we explore those options first. And if there's really nobody else, then we can. When to report? Obviously, immediately, like I said. If you guys see something, hear about something out there, let us know immediately. We take live calls, again, like I said, Monday through Friday, 8 to 5. However, you can make a report at any time via voicemail, mail, or fax, or I think the best way to do it is with our public online reporting system, which there's going to be a link to eventually here. I think if you also Google like Washington APS report, it should come up. So I think it's the top response if you Google that, but it's pretty obvious on our website too. There's a link to click on that to find it. And I think it's quick, it's easy. You fill in the fields on it, just like we all do for so many things now. Click submit, and you're done. So there's the phone number, 877-734-6277. Yeah, that's the centralized intake phone number. We used to, if you've been around for a while, APS used to have regional reporting in all the different regions, or intake in all the different regions. We're now centralized intake. So all the intakes go through headquarters now from all around the state. There's also the CRU, right? That's for things that happen in practices and facilities. That would be to RCS. That's the 562-6078 and 186 end harm other way. But again, I think the best way, if you can, and the most straightforward and easy way, is to use this. And I think that the slide deck is going to be available, is to use this website to go on. It's just like, it's a fillable form, like I said, like we're all used to for so many things in our lives these days. You go on, you put your information in, put the information about the other people involved, you put the information, you describe what you knew, you click submit, and APS gets it right away into our intake unit so that they can screen it. Again, that is our training email address for our headquarters training team. There are 5 of us program managers on that team. If you have specific questions about APS, you can reach out to that and we will get back to you. So that's what I have. If there's any more questions or discussions that people want to have in areas that people want to talk about, happy to entertain those.